Lynn Brown.
Grateful, Madam Deputy Speaker. Can I tell the benches opposite just a little bit about the mental health crisis in Newham? We have a rocketing population, which is young, and no commitment from this government that health funding will rise to match it. We have almost 41,000 children living in poverty. We have the highest proportion of people living in damp, mouldy, overcrowded, temporary accommodation in the country. All of these people have no sense of security in their home at all. They don't know when their local ties will be shattered yet again by a forced move. And all of this impacts, as we know, on mental health and on the mental health of children particularly. I see it constantly in my casework, and local health leaders tell me exactly the same thing. It can hardly be a surprise to this government that the number of young people being referred to mental health services is 30% up in Newham alone. And these cases are increasingly more complex, more urgent, more in danger of spiralling into deeper crisis. We're also the most diverse borough in the country, with the second highest rate of GP registrations by migrants. Our diversity has massive benefits, and I love it. But it requires clinicians to adapt their way of caring for people with different cultural backgrounds and languages. But despite all of this, Newham's mental health spend is the lowest in London. So with all of these challenges, our clinicians and our health leaders are struggling to meet their targets, obviously. Average waits in Newham between referral, assessment and treatment were at 12 weeks in 2021. Some patients are waiting for as long as a year, and that's after they've had a referral, which, as we know, is terribly difficult to access. And locally, our mental health unit, which of course only deals with the most severe needs, is at 98% occupancy. 98%, far in excess of the clinical standard, and not just the quality of care, but patient care and safety is suffering. And there's a dire shortage of specialist mental health beds for our older adults. So we have older people waiting long periods in utterly inappropriate wards and in beds that are no doubt sorely needed for those waiting for other hospital treatments. Many patients with mental health crises are waiting in emergency departments for over 12 hours, and local health leaders are worried that these numbers will increase. Our mental health services are now struggling even to react to some of the most dire situations, let alone being proactively able to offer support that prevents mental illnesses getting worse. So we are creating even more problems, greater problems for the future, greater costs for the government, greater costs for the NHS, more antisocial behaviour, more homelessness and rough sleeping, and massive, wasted economic and social potential. People's lives are being devastated by treatable ill health, complete avoidable misery. And if we aren't sitting here in this place to avoid that, then why are we here? Labour's plan to transform mental health treatment is desperately needed in Newham, with thousands more mental health staff, professionals in every school, and accessible mental health hubs in every community. We sorely need a preventable approach so that we can bring this crisis to an end, and we need it now. So can I use my last 30 seconds to look at the Minister and ask her if she will meet with me and my health providers, my health leaders in Newham, to talk about the massive underfunding that our borough, my community, faces?